I'm very excited to see the names on here. I think just between all of us on the screen here, we're good friends or have worked with each other. So thank you for your support and thank you for wanting to learn more about how nurses can get involved in advocacy. Hey, Courtney. Miss Ann Ireland, so happy to see you here, and Annie from us all the way up from San Francisco. So very excited tonight to present this. My name is Jelani DeCastro. I'm a registered nurse from California. My specialty is oncology, and I have a passion for advocacy. I'm excited to present a good friend of mine who you may know. And she's going to present to us on the importance of civic engagement. Oh, all the way from Eastern Canada. That's exciting, Anne. But just before we go into that, I do just want to give a little bit of a background on what the Oncology Nursing Society California Advocacy Summit is. So we are a group of oncology nursing chapters from all over California. So there are a total of 18 chapters, and in the past 2 years, 12 to 13 chapters have come together to join in grassroots advocacy in improving cancer care in California. I know that Alicia has participated in some our summits. Annie has been part of the planning, and Ireland, who is from ONS, has been just a supporter of oncology nursing for years and years, and is a wonderful mentor of mine. But without further ado, I want to introduce Miss Alicia Truelove, MSN RN, CB board certified and NPD board certified. She is currently a fellow with Vot-ER, and you'll learn about Vot-ER a little bit more in a moment. She's currently an education program coordinator at Cedars-Sinai Hospital, Marina del Rey. As I mentioned, she's a 2024 Vot-ER fellow, and she's also active in professional nursing organizations such as ANA California and the National Association of Hispanic Nurses. So she has been an inspiration for me in terms of advocacy, and I know many of you are part of this community and are committed to making not just healthcare better for our patients, but I think we joke about it, but there's also some truth in it that I think nursing is going to save the world. And I firmly believe that, we save people's worlds every day in terms of taking care of them and their families. And, we have it in our skill sets to do more than that in the world beyond. So without further ado, my good friend, Alicia Truelove.
Well, thank you so much, Jelani, for that introduction. For those of you who are joining us, Jelani just introduced me, but we're going to go ahead and get started on our presentation for this evening. Please do feel free to ask, any questions in the chat. You can, go off mute. This is more of just an informal chat and getting together to talk about some of the work that Jelani and I are doing. So again, thank you all for this opportunity to speak with you all today about Vot-ER. So Vot-ER, if you all are not familiar, is an initiative that is physician founded that aims to bring voter registration into the healthcare space. Vot-ER provides patients the opportunity to register to vote. They provide tools for that, for us to do that in the healthcare setting. Because, at the end of the day, reality is that much of our healthcare system and our healthcare experiences are determined by the policies that our elected officials implement. Okay, my name is Alicia Truelove. So as Jelani had mentioned, my pronouns are she and her. Jelani is here with me. She is also a Vot-ER fellow for 2024, and we've been on this journey together for a few months now. We're going to chat a little bit today about the link between voting and health, how Vot-ER can help bridge that gap. We'll talk a little bit about some compliance questions, and ways that you all can get involved. So the link between voting and health. You can see the relationship between voting and health nationally. There are a lot of bodies of evidence out there that are kind of starting to talk about the correlation between voting and health. One example of those research is the Health and Democracy Index. And it shows that states with less voting access have worse health outcomes, while states with more voting access have better health outcomes. You know, these communities that face barriers such as structural inequities in transportation, internet access, and even accessible spaces for communities suffer from a lack of social inclusion. They also are more at risk for a reduced sense of belonging, and at the end of the day, less access to health resources. All of those factors are associated with poor health outcomes, such as greater risk of chronic disease or even higher infant mortality rates. With that being said, we can't start to address these social determinants of health until we begin to address the interventions towards the bigger causes. And that's kind of where voting plays into the upstream causes of where voting can be most effective. With that being said, there's also a historical context of nursing involvement in social justice issues, specifically with voting as well. So an example here, in the late 1800s, nursing began to emerge as a formal profession in the United States. Early nurses recognized the importance of having the right to vote, especially when it came to voting for legislators who would advocate for that nursing profession in its early stages. At that time, women's suffrage was a controversial issue, believe it or not. So even amongst women and nurses in general, there was a lot of controversy, a lot of support, a lot of not support. Some nurses were even arrested and jailed for their involvement in allowing women to vote and hold office. So that photo there is an example of some of our past nurses who joined in these suffrage movements. And then all of us here on this call, we know that nursing continues to rate highest amongst the most ethical professions. And really, I feel like a big reason for that is because we are advocates. We advocate every day for our patients. We advocate for them, whether it's in a clinical setting, in a hospital setting, whether that's in the communities, our clinics, or even in the halls of our nation's capital. So, I may have been able to have the pleasure of participating with you all in your Advocacy Hill Day. And I have to say that, the Advocacy Summit was early this year, I'm sorry. And honestly, I didn't realize how profound of an impact oncology nurses have when it comes to policy. I learned so much from you all, listening to your positions and speaking to the legislators. So I really do applaud each and every one of you who are on this call today for your involvement in understanding the impacts we as nurses have. Because as you saw previously in that last slide, we are standing on the shoulders of those who paved the way for us to continue this work to serve our communities through social justice. So thank you. Thank you all. So similar to the nurses who were involved with the suffragist movement, Vot-ER came out of a realization of a major issue with our democracy and our healthcare systems here in the US. So here in the US, there are approximately 72 million eligible people who are not registered to vote. That number is equal to the amount of the entire population of France. So Vot-ER, they ask that question of why are people not registered to vote? And the answer that they were, able to pinpoint is because that people really have never been asked to vote. So out of that number, 72 million, approximately 62% of unregistered voters have never been asked to register to vote. So here, a little bit of this data is showing that the highest percentage of that number, 16% of those folks were asked to vote through government agencies such as the DMV, such as, post office. If you're changing your address, they ask you if you're registered to vote. So that was where that ask was most identified. But Vot-ER has also identified, the healthcare setting as another avenue for people to be, asked to vote. When you're looking at the top 3 groups of people who make up that 72 million number of unregistered voters, there's a lot of data out there that's showing that these are folks who are young, maybe, first-time voters, folks who are lower income, and also people of color. When you think about those populations in terms of the folks that you see in your day-to-day work, you see those patients who are most marginalized by our current healthcare system. It's kind of those similar groups. So, again, Vot-ER asks that question: what if these patients were asked to register to vote in a healthcare setting? How would this begin to transform their own healthcare experience? Here in 2021, there was a study that was conducted in the Journal of General Internal Medicine, was published, and found that health professionals are 12 to 23% less likely to vote than the general population. They specifically pinpointed, the nursing profession, sharing that nurses are 10% less likely to vote. So, with that one study, what does it mean for our healthcare system when health professionals like us, the people working at the bedside, working in these clinics, in these acute care settings, those of us who see the real and true impact of policy on our patients and our institutions, what does that mean when we don't vote? I wanted to share a very quick personal story with that data. Back in 2016, sorry, I was working, I just started a new role, kind of getting to know the climate, understanding the situation that I just had started, working in a burn ICU unit. And I was commuting to my new job, despite the fact that our institution at that time, provided us time away from our role to actually cast our vote. I wasn't able to leave and come back within that time frame they allowed us to. Luckily, here in California, we have a lot of opportunity through mail-in ballots and all that to vote. But I didn't plan for it. I realized, oh, I'm working that day, and oh, I don't have a mail-in ballot, and I wasn't able to cast my vote. So, it's still something that it brings a lot of shame to me, and hopefully in sharing this story, that it might, kind of help you to plan a little bit, especially if you're working, on the unit and you need to kind of plan ahead of time to be able to cast that vote. To please do, because it really is important. It does have an impact on the policies that we practice under as nurses. So, moving on here in June 2022, the American Medical Association recognized voting as a social determinant of health. There have been other organizations that have made similar statements. Those include the American Public Health Association, additional organizations. However, in talking about nursing, there is an opportunity for nurses. There's still an opportunity for nurses to advance that work, to declare voting as a social determinant of health. We all know that the nursing community is large. There are still many left within our community that we need to reach. So if you think back to that photo earlier of those nurses fighting for the women's right to vote, think about it in that context. I mean, nurses really do lead movements. So my ask to you is think about any opportunities that you might have in the settings that you work in, or that you're, maybe your professional nursing organizations, that you can make a declaration stating voting as a social determinant of health. So a little bit about how Vot-ER is able to facilitate that work for you. So they do have a few tools that enable you to do the work either at the bedside or in your community. So I'm not sure if any of you are familiar with the Vot-ER badges. So I actually have one here on my on my badge app from work. Patients are able to scan that QR code, and then they're taken to a website asking them to register to vote in a nonpartisan manner. There are also customizable digital tools and materials for organizations who maybe want to put up a poster in their lobby or anything like that. Vot-ER also has some great tools in terms of toolkits and pre-populated templates that you can use to continue this discussion in your settings there. So these tools really are meant to be undisruptive, something that you're able to just kind of show and use with ease. But also these Vot-ER tools are nonpartisan. And that comes into play when you are navigating these types of discussions in your workplace. Oftentimes our workplaces, our organizations, they can sometimes be a little risk averse, especially when it comes to, these types of discussions of civic engagement and things like that. But, the tools are meant to be, how do you say it, non-threatening, for lack of a better word. But, with those tools, Vot-ER also offers that sense of mentorship, and so they do offer fellowship programs like the one Jelani and I are in. They offer different types of campaigns that are structured more towards, maybe nursing students or students in general. Right now, they have established a campaign around Civic Health Month. So they've declared August as Civic Health Month. So there's, they're doing a lot of great work. And of course, with that work comes the work that we do. I also just wanted to very quickly share my story with starting this discussion at my own organization. So for some background, our fellowship, has allowed us to start to have these kinds of discussions within our organizations. I mean, at the end of the day, Vot-ER is meant as a tool to use in healthcare settings. So I sent a quick email to our Director of Health Equity here about the importance of voting as a social determinant of health. That kind of piqued her interest. But I also spoke about the topic from a patient satisfaction perspective, kind of asking what types of structures we as an organization have in place to ensure our patients preserve their right to vote if they are hospitalized, or if they're here for an extended amount of time, or maybe they're here, in as an inpatient on voting on election day. So I kind of asked those questions to them. The conversation, it was well received. I'm still working with their office to advance that conversation. But I kind of approached it through that sense. It is a patient satisfaction goal, that can be attainable. And it kind of helps navigate that apprehension a little bit of organizations that may not be so open to having civic discussions in their settings. So also keeping that in mind, I had to do a little bit of research when developing what I was going to say to our leaders, and Vot-ER has some great resources on that. According to these various guidelines here, nonprofit organizations are able to conduct nonpartisan voter engagement activities that are designed to help the public participate in elections, as well as engage in such activities through voter registration, providing voter education, how to vote, not who to vote for, but how to start that process. And also they are protected to engage in that get out the vote work. So many hospitals and clinics are nonprofit organizations. And, with that being said, Americans also have more regular interaction with their healthcare providers than with other government organizations, such as the DMV or the post office. So bringing voter registration ability to our hospitals would be a really important touch point for our patients. Vot-ER's platform ensures that providers remain nonpartisan and helps provide that level of confidence to staff when they are helping patients register to vote. Also down here at the bottom, then the 1993 National Voting Registration Act, it's also known as the Motor Voter Act. It actually encourages this type of nonpartisan voter registration at healthcare centers specifically. So that means that clinicians, healthcare organizations, healthcare workers are able to point patients in the direction of posters or handouts. They're also able to inform patients that they're offering a service to patients to register to vote, but we do not endorse any political party, keeping that nonpartisan theme at the forefront. Also, healthcare organizations, clinicians can help the patient complete their voter registration form, all while remaining neutral. So that is a photo of the badge. If you do order a badge, it comes with that lanyard as well. But I wanted to share our campaign here, Nurse the Vote. So if you at all feel inspired after this discussion to start these discussions around voter participation, I do encourage you to scan the QR code there on the screen. By doing that, you are joining Jelani and I to nurse the vote. We do encourage all levels of engagement, whether that's just signing up for a Vot-ER training, discussing ways that you can implement voter registration in your work setting, registering for a Vot-ER badge, or if it's just simply checking in with your loved ones, your neighbors, anyone to see if they're registered to vote. If you want to share some of these resources that we've developed with our campaign, that's also a great way to, kind of spread the word. Again, this type of work, this civic engagement work, is really a vital part of our nursing profession. We talk about it all the time, but these decisions in healthcare really cannot continue to be made without the voice of nursing. So with that, I thank you. There is my contact information, my personal email, along with my work email. I just, again, thank you so much for allowing me to have this discussion with you all. I would love to answer any questions anyone has, or if there are any comments, any concerns, please, I would love to hear from you all. So thank you.
Thank you, Alicia. Always wonderful just to hear you present and talk about advocacy. There is a question in the chat box, and as I'll read the questions off to you, but I was hoping, if you're able to, if you can type in the chat where you're joining us from tonight. We may not be many in numbers, but it warms my heart because our reach is really wide. I think there's like 4 or 5 states represented just in this group tonight. And also I'll be sharing this on YouTube, so feel free to rewatch it or share it with your friends. So Santa Barbara, San Francisco, Anne is from or is in Eastern Canada right now, Florida, Minneapolis, Minnesota. And Alicia mentioned the Nurse the Vote campaign. I do want to have a special shout out for Darcy McCampbell. She is on the webinar tonight, and Darcy came up with that hashtag for our group. She is our co-fellow in the Vot-ER fellowship. So special shout out, Darcy. It's a wonderful name. Carolina has a question here, and she wanted to know a little bit more about your background. And I don't know, Carolina, if it was more general or in terms of advocacy. You can come off mute, please. I welcome anyone to come off mute.
I like to use it as a background, so if you want to share it, I could put it, we're in meetings all day long.
Yeah, so the Civic Health Month background?
Yes.
Yes, I would love to. Yes, I would love to share that with you all. Jelani, yeah, let me know how I can get that to everybody.
Jelani, and send yours too at some point. We could start using that one.
Yes. Send me yours, Alicia, and then I'll send it out to the group. The representation on here is wonderful. And again, there's that quote from Margaret Mead, and I'm just gonna really paraphrase it, but it says a small and mighty group, right, can accomplish great things. And in the beginning, there always has to begin somewhere. All it takes is a small and mighty group. And correct me if I'm wrong, and Ireland, I know you're on here, and she's been with the ONS organization for a long time, but from what I remember, the Oncology Nursing Society started, I think, in someone's living room, or just got together a bunch of oncology nurses that wanted to advance the specialty and the profession, and going on decades strong now with a large representation from all over the states. I just want to share what strikes me with this presentation. This is probably the 3rd time I've seen this presentation, and we have really fabulous mentors at Vot-ER. And when you come across something that's so so great and wonderful. You want to share it with everyone, especially your friends, and especially within our nursing community. There's so much I think that we have the power to accomplish, but also the responsibility to carry out. But when Alicia talked about how many people aren't registered to vote just because they've never been asked. So imagine that they've never been asked. And as nurses, we ask all sorts of obtrusive questions all day long, right? About drug use, their sexual activity, all this stuff. And again, there are different ways you may have to navigate this with your organization, but considering that voting is a social determinant of health, I mean, that's probably not as obtrusive a question, right, as some of the other things we ask, and framing it in the terms of civic health versus politics, or something that can be triggering in that respect. I mean, when you frame it as civic health, it really brings another perspective to it, how being civically engaged has a direct effect on your healthcare, your family's healthcare. And when we talk about civic engagement, there's different levels of it. And probably the easiest way to get involved is register to vote and vote when there's an election, because being knowledgeable about your issues that affect your community is a great way to begin in that advocacy journey. So it doesn't necessarily have to be, flying to Washington, D.C. or your state capital to talk to your legislator, but registering to vote, voting, encouraging your peers to do that is a big step, because it always amazes me how many people aren't registered to vote, where as you know, in other countries, people are like fighting for the right to vote. Alicia made mention of it earlier. 100 years ago, women were fighting for the right to vote, and here we have the responsibility, I think, to honor what they fought for and their sacrifices. So I welcome anyone with questions. If you have any comments or anything at all, we still have a little bit of time here. Even if you have questions about getting involved in the Vot-ER Fellowship, we'd be happy to talk about that. If we have questions on the oncology California Advocacy Summit, we have some representation here from that can talk about their experience. So this is kind of like a mini open forum.
I'm posting it on Facebook, and you mentioned in the 1900s. Do you have a specific date for that? I know it was in your post, in your presentation. And then I'll stop asking questions.
I love all your questions, Carolina. You always have great questions.
Can you see that?
So 1917.
So it was, yep. So this, yes. This photo was from a suffragist movement, suffrage. What amendment was that? Like 15th, 19th. But yeah, November 10th, 1917. There's a few nurses in there that were fighting for the right of women to vote as well.
And again, too, we want to stress the bipartisan or nonpartisan focus on this. We just want people to register and to vote. How you vote is up to you, but also we have confidence in the nursing profession. I mean, this is how we practice. We practice with evidence-based principles, and we consider like a care plan from different angles, right? So we're very educated. We're one of the most educated, if not overeducated professions, I think. So in terms of taking the ball and running with advocacy, I think we're really poised to be leaders in this. So it's just getting more nurses involved and taking the fear out of talking about these things. And I don't know about you, but I know when Alicia and I talk about this and some of the people from the oncology, California Advocacy Summit, it's fun. Like it's, when people ask why I do it, I think it's fun. And, you know, you're with a passionate community of nurses and like I know that there are nurses out there that are just clinically focused, and that's wonderful because I'm not going to be like, I'm not an ICU nurse by background, but I have my strengths, right? We each have our strengths. And so we need voices like ours to grow and to kind of inspire other nurses. So who knows how this is going to be in 100 years. I mean, 100 years ago, the women in that photo, would they think that there would be nurses from all over California on the Zoom call, or not California, all over the United States on the Zoom call, talking about them and the work they did. And so it's about building on previous work and supporting those who are going to come after us.
Yeah, just like that comment in the chat, you know, I mean, I know for me, a big reason why I do this work is for, you know, my children's future. You know, Jamie said your 18-year-old will be voting this election. I mean, you know, my kids are going to be 5 and 7, and you know, the work that we do now really is going to set their future. So you know, yeah, making sure that we're involved in the things that are being decided as nurses is just, it's so essential to our profession. So,
I just want to say thanks both of you for this. And I'm just wondering whether there's any like cheat sheets or like card kind of things. Like, you know, there's so many very cool points about like the non-participation of nurses in voting and all that we could share as part of the movement. Whether any of that has been developed to distribute, because I think a lot of people might maybe not want to talk and discuss it so much, but if there was a little thingy that we could share, that would be a great resource.
well, I mean, I'm open to sharing the slide deck. It has some basic data points in there. It has, you know, some of the references in it. So I can certainly do that. I know Vot-ER, if you go to their website, they have a huge resource section that, you know, they have anything from, you know, talking to someone who has never voted or feels like their vote doesn't matter. You know, they have talking points there. They have a whole list of resources that are available for free. So I can definitely, you know, if you check out their website, that's a great starting point too. But a really interesting point with your question is the founder of Vot-ER. His name's Alistair. He's a physician and emergency room department physician, and I met him through he was speaking at our National Association of Hispanic Nurses Health Policy Summit, and he did mention that there is not a lot of research in this realm within the nursing profession, that there is not a lot of data there. So he brought up that point, and I thought that was a really interesting topic. And, you know, he kind of threw out there could be a great topic of research in the future. So yeah, I mean, you bring up a really good point.
Or Suzanne, as you know, in planning the Advocacy Summit, if it doesn't exist, we can build something. So they're always
That's
somewhere.
right.
Yeah, and as Alicia mentioned, Vot-ER started with Dr. Alistair Martin. And in fact, the badge that Alicia showed, I ordered a badge maybe like 2 years ago. I saw something on the internet, I ordered it, and I just thought it was a really cool thing. I didn't engage anyone in terms of voting, but it was kind of like a silent symbol of, you know, like what are you civically engaged, or what is that? It could spark a conversation. But what I really found out about it was it wasn't just for physicians, because that's originally why I didn't delve deeper into it, because I thought, oh, well, has to do more with physicians. And then Alicia she found this fellowship and asked if I wanted to join with her. And, I got to learn more about Vot-ER. And I'm finding that nursing is really behind in terms of how we could be more uh, civically engaged. And, physicians, many people in this fellowship are fellows, or they're still in med school, or they're still in undergrad work, but they're already getting their advocacy chops, like so to speak, so that when they're out there practicing in the real world, it's just part of their practice as they're assessing their patient or caring for their patient population. They always have it in the back of their mind of how is this going to look like in the legislative space, in the advocacy space. Whereas for the nursing profession, I think most of you may have experienced it. You don't talk about advocacy or these things until like you're in a graduate program. I mean, some undergraduate programs may have changed by now, but at least in my time, like I didn't even think nurses could get involved in something like this, which is false, right? We can go ahead and get involved in this and we don't need permission from anyone. But I think it's also us spreading the word out there that nurses can take the lead in this. And, our physician partners, they're already very active in this. And because of the issues that came out from the most recent Supreme Court cases and elections, a lot of the physicians in this fellowship are OBGYNs or, involved in maternal health, because they very much have a stake in how they're able to practice where they are. And perhaps like more nurses aren't involved because it just hasn't hit us hit home yet. But then, there's that old saying, like people don't get involved. Like you see your neighbors get affected by something, but until you get involved, that's when you feel like you need to make your stand on something. So, let's not wait to get to that point. If we can get ahead of the curve and empower other nurses and inspire them, and to normalize nurses talking about how policies and politics affect our profession, then, it has to start somewhere. And it's exciting to see how this group from all over the United States grows and grows every year. Another tool, perhaps, Suzanne, I don't know if you are part of the American Nurses Association, but if you are, they do have also an advocacy arm, and they have these buttons that say registered voter, registered nurse. I know Alicia has some from her last visit to Washington, but they're free. You can order them from the American Nurses Association, and it's just kind of like a way to engage people in talking. Hi, Dr. Scalia. How are you doing this evening? Good to see you.
Good. I liked how you mentioned about graduate school. I've had the opportunity last semester to teach ethics and healthcare advocacy. So just designing the course, and it's really exciting seeing, but I do teach in the graduate program. So yeah, just because I voiced an interest and told my chair how I was involved in advocacy, so I get to teach the next shift of nurses, have them write and ask, and all kinds of fun and exciting things for them, see how they can make a difference. So I really love this social determinant of health, and I already ordered my badge. I'm going to have my students order a badge. So thank you so much. This is really exciting.
And
Oh my gosh.
yeah,
Yes.
it's exciting. And Vot-ER, they partner with nursing schools as well, with universities, colleges, hospitals. And so it's just getting the conversation started with your organizations, and they can partner with you. And again, our physician partners are way ahead of us. Like there's like entire medical schools that are that have Vot-ER embedded in their programs. Epic. So the Epic EHR, actually, they do have a functionality where they can build in a question about voting because it's part of the assessment. So there are some hospital systems that have already activated this. So this just food for thought if you're ever at those tables where these conversations happen, and you can offer that. And again, like you said, Dr. Scalia, unless you mention it or talk about it, people might not even think about it. So
Yeah. I just want to, we're all not in this alone. So if you need any support, any resources, anything, please know that you can always reach out to me or Jelani, and she can get to me, or anything that you need. Again, like we're all not doing this work alone. So any resources you need, anything at all, please do let me know. I'd be more than happy to help support anything you're doing, especially when it comes to, you know, our future generations. So yeah, let me know.
And I see Courtney has a comment in the box there. So yes, we will send you information on how to get involved in the fellowship. And I really owe it to Alicia. Alicia was like, hey, do you want to do this thing with me? And as she knows, I'll say yes to anything she asks. I'm like, yeah, sure. And
You
it's a-
guys are doing a great job. It's these little podcasts that may seem small, but they'll have a very wide reach, I think. And it's so important. So thank you both for everything you do and making it fun.
Yes. And I have, like everybody on here is a dear friend or mentor in some way. And I do have a special shout out to Dr. Caulfield as well. So when I was in the fellowship with the American Nurses Association, California Advocacy Institute, that's a long title. Dr. Caulfield was a mentor for me and another fellow. So thank you again just for supporting us and inspiring us. And even just your presence, I think it does so much to get people started on this journey. So thank you again, Courtney, for that.
You're so welcome. You guys are doing so great.
Thank you. All right. Well, like I said, I will have this recording available. I'll send it out as an email. For those of you that may or may not be aware, I do have a YouTube channel that I really open to anybody that's interested in advocacy. If you have a video to post or anything at all that has something to do on the topic of civic health, voting, nursing, anything, I'm more than happy to post it on my Citizen Nurse channel. Alicia and I are very involved in social media. And I have yet another shout out tonight to Dr. Malloy in Florida, because she actually has a curriculum at the university. She teaches us on nurses and social media. And I think it's one of the few, if not the only ones in the country. So she's a great connection as well. And social media is powerful, and whether or not you like it, it's a wonderful tool, and we really have to leverage it because it's what's going to carry our message further. And it's it takes a little bit getting used to, but like with anything, we get used to it. And thank you again for everyone. Thank you on behalf of the Oncology Nursing Society chapters of California for being part of this webinar. And then we plan to do more webinars leading up to our Oncology California Advocacy Summit in April of 2025. And we aim to have speakers that will give more insight on advocacy and just updates on the state of oncology care in California. So if there's nothing else, Alicia, do you have any closing words or anything else you'd like to say?
Just thank you all so much for your time, and please do reach out if you have any questions, comments, concerns. Thank you so much.
Have a wonderful week, everyone. Take care.